Happy Tuesday, Doc.
Hey, Miranda, how are you?
I'm doing good.
Good. Want to chat?
Sure.
Okay. Let's go into one of the treatment rooms.
Fabulous.
Yeah. I thought we could talk today about muscle pain.
Okay.
Specifically, what we'll often find from patients is that when they come in with a new issue, they'll describe the pain and they'll frequently tell me, I think it's a pulled muscle. I think I got a muscle issue. And let's talk about, let's say, something in the lower back. So if they're pointing like down here, like, you know, it's really painful down here. I think I hurt myself. I think my muscles are sore. And I'll ask them questions about that. What we'll frequently find out is that the muscles are not the problem. The muscles are reacting to some bigger issue in the joints, in the alignment of the bones themselves, and perhaps even some pressure on the nerves as the nerves leave the spine. So patients will feel pain in the muscles, but the muscles are just a reaction to what's going on. So to make better sense of that, it's good to understand like what the muscles do. So like a muscle goes from one bone, it connects to one bone, and then it goes to the next bone, or maybe a bone further up the line, and between those bones are joints. So when the muscle contracts, now the joints move. If the joints are in the right alignment and the nerves that supply the muscles are healthy, the muscles can do their job, unless someone really strains a muscle, like trying to sprint and they pull a hamstring or something like that. However, what we'll frequently see here, I would say 90% or more of our patients who have pain, whether it's back pain, hip pain, shoulder, neck issues, things like that, most of the time, if the joints are not in the right alignment, the joints aren't moving the right way, or there's some sort of pressure on the nerves that go to the muscles will be tight and tender and irritated, but it's the joint that's the problem. It's the alignment and the fact that the bones aren't moving properly. And then once we can establish those joints and get them moving better, patients feel better. And certainly I'll give them ideas of things they can do to help with their muscles, because the more people do the right exercises, work on their posture, just be more mindful of like daily movements, they get a lot more out of their chiropractic care. Their joints feel better, and then certainly their muscles feel better too. But it's one thing a patient brought up to me, I think last week. They're like, I think it's a muscle issue. It turns out it wasn't. But we don't always understand what's going on with our body. I thought that was a good thing to clarify in terms of a lot of times when our muscles are sore. I'll make the analogy, it's like having a fever. If you have a fever, there's increase in body temperature because there's an infection somewhere. The fever isn't the problem, right? It's the infection somewhere that's causing the fever. So that response that the body has is a signal that there's something wrong. So certainly pay attention to it, and we'll be able to help them out.
Well, that sounds great. Thanks for the info.
Thanks, Miranda.
You're welcome.